Hi, this is Dr. Nick. I'm here at the CES 2020 at the Digital Health Summit, and I'm excited to be joined by two guests this afternoon. Nancy Howell Agee, and she is the president and CEO of the Kataria Clinic, and Anjali Kataria, who is the founder and CEO for MyTonomy. Thanks for joining me today.
Thanks for having us.
Thanks for having us.
So tell us a little bit about what's going on between the two of you. I know you've formed a partnership. You have a digital strategy that is targeted at patients. Explain what that is for the viewers out there.
So we are developing a digital front door so that consumers and patients can access our health system anytime, anywhere, from any device. And it's much more than simple things like online scheduling or self-scheduling or ED fast track. It's access to your own health record. It's communication with your providers. For us, it's also telehealth, reaching into our rural areas. And MyTonomy has been an accelerator for us of developing this whole large strategy where we, what I'm excited about is that it's meeting patients' needs when and where patients want information. And I think Anjali can talk a little bit about what that looks like in terms of short films and Hollywood quality.
Sure. So thanks, Nancy. We're based in Bethesda, Maryland. We're an enterprise software SaaS cloud. We have a patient experience cloud. We also have a studio where we produce original content, short form, 30 seconds to 3 minutes, high production value, original content for streaming, optimized for mobile streaming that we deliver through the cloud to patients anywhere on any device that enables them to care for themselves in new ways, to become more autonomous, to learn how to care for themselves when they're not in the clinic, when they're at home, learning how to give themselves insulin shots or how to prepare for their upcoming surgery or how to go into cardiac rehab and to do the exercises so they can get healthier.
So as an example, I just went through a whole CGM process. I put a continuous glucose monitor. This is the kind of thing that would essentially have me less fearful of that just gigantic needle that appeared in that, right? Is that the kind of thing?
Exactly. In fact, we produced CGM custom content for one of the tech giants because they had a virtual care clinic, and we found that their patients were able to access the content, receive the CGM mailed to them at home, open up the box, and they were watching the videos on how to assemble the CGM device. We work with the manufacturer of the device to make sure that it was a supplement, nothing changed. And then they were able to put it on themselves. They were able to calibrate it with their phone. They were able to connect to the virtual care clinics app. And then they were able to be part of a remote patient monitoring program. So we're the pre and the post in the remote patient monitoring.
I can't tell you how excited I would have been to have had that, because when I opened it up the first time, that needle looks awfully big. So fantastic to give it to people where they need it. You've obviously got experience with the patients, and you've signed this partnership. Tell us a little bit about what's happening in the Kataria system.
So we're rolling this out, taking a look at the kinds of patients that we have most common needs. Chronic illness like hypertension, hyperlipidemia, diabetes, cardiometabolic issues, but also orthopedic issues, so like total joints, total knees, and we're starting there. We also, as you may know, where we live, we are in an area that's very much hit by the opioid crisis, and so we're developing content and using it
even directed for the opioid crisis as well. Fantastic. And as you think about the future, what are the other areas that you're going to start to target? What else do you see developing? Because I think there's a huge need for this. We've sort of we're putting people in the medical home, but they feel disconnected. Now here's a solution, and it works across all networks?
It does. We started out with cardiology and then diabetes, hypertension, hyperlipidemia, because we wanted to cover we could get to 50% of all patients if we focused on cardiometabolic. from there, we expanded to labor and delivery. We expanded to orthopedics, as Nancy mentioned, and we expanded to PT and to home PT, and moving into the home, the exercises that are typically done in rehab or in a PT office. We then realized that there's a great need for more education in the home. So thinking about health and wellness, sleep, meditation, how to live in your home in a healthier way. That's a broader health population. And opioid was just the beginning of realizing we need to do more in mental health and more in addiction.
So
food addiction, alcohol.
Feels a little bit like Coursera for patients and all of the clinical support, and even for patients and their relatives, I would imagine, right?
One thing we really like about this is that the patient can see it as often as they want. They can share it with their friend, their family, if they choose to. So it gives the patients control, and I think that's one of the most important components, is that they have more control, they're less afraid, they're more engaged, and we know that creates better health outcomes.
Fantastic.
So we're moving more from 30-second to 3-minute segments into slightly longer segments, like 4 and 5 minute narrative and more story-oriented segments. So I would say it's like a Netflix meets YouTube for healthcare, where we're doing more story and more entertainment education is in the future. So
Enter-education.
Yeah.
Edu-entertainment.
Entertainment, yeah. Short form, short series, characters that you can recognize. We do a lot of animation already, but we're finding that peer-to-peer, the narrative story, in addition to the animation, is so powerful, and people watch so much. I spent 42 minutes watching content in my autonomy today.
We watch enough cats. This is actually useful information that people can gather and apply to their own personal health. Fantastic.
Yeah.
Well, Nancy, Anjali, thank you for joining me today.
Thank you.
You're welcome.
This is Dr. Nick. I'm here at CES 2020 at the Digital Health Summit.